Thank you so much. And I'm going to introduce my colleague here, Michaela, who will start out our presentation. Thank you.
Thanks, On. Um, so, hi, everyone. My name is Michaela, and just thank everybody for joining today, and thank you to Cyber Trust Alliance for inviting us. Before I get dived into our presentation, just a little quick thing about who we are. We work for a company called PrivaPlan Associates, and we specialize in HIPAA privacy and security rule compliance. We offer a wide array of services and products, including guidance on HIPAA privacy and security, HIPAA training, security risk assessments, and a ton of other items and services. So at the very end of the presentation, our contact information is there, and I know we're going to kind of be dumping a lot of stuff. So if you end up having any follow-up questions, you can feel free to contact us as well. So, all right, so let's get going. So we're going to be talking about vendor and BA management, which stands in for business associate management. So I guess first thing to get started with, in terms of this topic is, first of all, why does it even matter? Obviously, the first thing is compliance with the law. So the HIPAA privacy and security rules require that covered entities safeguard protected health information. And we're going to possibly go in a little bit to a few acronyms. So covered entities, I may call CE occasionally. Protected health information, I think we're probably all relatively familiar with the idea of PHI. So since most covered entities, a clinic, a hospital, insurance carrier, whatever it is, doesn't necessarily do all the functions that are required, for their services, they contract out vendors, different other businesses who are helping them to work with their data. So the privacy rule also extends to those third-party vendors who use, store, transport, or disclose that PHI. So these are what are called business associates. And so by law, they are also required to protect PHI under the HIPAA rules. So the covered entity is required to maintain a contract or business associate agreement, which you'll see written in here sometimes as BAA, that would outline their relationship as well as define any acceptable use or disclosure of the PHI information. And we're going to get a little deeper into that in a minute. So next slide. So the other reason, obviously, for why this is important is that it's security and business best practice. So regardless of the HIPAA side of things, an organization that accesses your systems and your data immediately increases what we call the attack surface of your organization. So meaning it just gives more opportunities for any kind of bad actor to be able to get in and get to your stuff. So if you think about it like this, let's say your organization has, 5 servers and 1 email system, has a couple of, cloud backups. So if your vendor has 6 servers, they have their own email system, they have 3 backup systems and a cloud-based suite of software, you've just increased your attack surface from 8 locations to 19 locations. So that kind of just to give you a sense of how that kind of increases as you go. And then of course, the more vendors you have, that just keeps growing out and out. So go ahead, next slide. So I've included a couple of examples here from the real world of why this is so important. From this slide here, I'm going to draw attention to a couple of them. So the first one here, this business associate that's called CHSPSC. they were providing services to clinics and hospitals and ended up being responsible for a data breach of 6 million records that affected 200 different covered entities. So you see how quickly this can kind of snowball to affecting huge groups of people and a lot of different, patients' data. So if you go to the next slide, thanks. Two more items I wanted to kind of note. The first is this North Memorial Healthcare of Minnesota, which had to pay a $1.5 million HIPAA settlement, a fine basically for failure to identify their business associate. So the vendor, Accretive Health, they had the breach. So North Memorial Healthcare of Minnesota didn't have the breach at all. Their business associate did. It involved, they had lost a laptop that ended up exposing about 7,000 worth of patient data. So the fine was not because of the breach itself, but because of the covered entity, North Memorial's failure to actually identify them as a business associate and have those contracts, the business associate agreement in place with them. And then the last thing to just kind of put the fear of God in everyone is, unfortunately, is there was a report that CI Security did in 2021. They looked at breaches reported in the last 6 months of 2020, and they discovered that up to 3/4 of those data breaches, came from business associates. So that just shows how the landscape is shifting in a lot of ways from covered entities having to just solely think about protecting their own data and actually going out to having to look at this whole network. I think it's good. Yeah, and now I'm going to pass it back to Han, who's going to talk about vendor and BA management.
Thanks so much, Michaela. So what are the elements of BA and vendor management? And so we like to start out with telling everyone to maintain an accurate inventory by starting with your accounts payable list as an audit and a sanity check tool. When the OCR started producing a protocol for auditing, the OCR is the Office of Civil Rights, they began asking if their covered entities had information on their business associates and business associate security official. And this accurate contact information is very important to have in the event of a breach. And we feel that annual audits and reviewing your vendors can keep that type of information up to date. For vendors and BAs, we like to see that there's a vetting process in place. So when you're looking at your accounts payable list and you're looking at all your vendors, you can see all the list of the folks that are working for you. And do you understand the actual scope of work that they're doing? Are you familiar with these vendors? Have you vetted them? We like to see that there's some sort of a process there. And if you've identified this vendor as touching your PHI, then is there a business associate's contract in place? And who is actually managing this business associate? So what I often see in real life when we go through our site reviews is if we see a business associate at a health center with some questionable security and privacy practices, perhaps there's a shared password that's posted, or there isn't a process in place for them to securely lock up their paper PHI, or there's not a process for shredding it, then I will often look at the health center manager or the CFO or COO who's in charge and ask, who is actually managing this business associate? And usually they'll point at each other, and it's often because it's not known who's in charge of managing this particular business associate at the health center level. So we see that often. We feel that regular risk management audits need to be in place for reviewing all your vendors and your business associates. And we like to see that conducted about once a year. We like to see that there's a process for terminating these business associates and vendors in place. And, once again, the accurate contact information, who is their security official? Do you have their phone number? Do you have their email, just in case of a breach or a disaster situation or contingency situation? You can get a hold of these folks and you have the information at your fingertips. Okay, vendor and business associates vetting. Is this required? So we often get this question a lot as a third-party auditor, and we like to tell them that it's important to prioritize the vetting according to the risk, the level of risk this business associate has to your organization. And what that looks like is how much PHI are they having access to? A lot of times it's a lot of PHI. And what are they doing with it? Is it a complicated process that they're doing for you? Is there a lot of PHI? So that raises the risk level, and those business associates and vendors will need extra vetting. A lot of times we have them, our covered entities ask us, who's best qualified to conduct this vetting at our organization? And many times we see that the right stakeholders are often not involved. We feel that IT should always be involved with vetting a business associate that is dealing with your PHI, because information technology and security, those folks are going to know the most about information security and how to keep that secure and what kind of safeguards need to be in place. So we like to see that there's a team of stakeholders involved when you're vetting these vendors and business associates. We feel that all vendors and business associates should be vetted somehow. And that can be just, are you getting this vendor or business associate from a recommendation from several trusted sources? At PrivaPlan, we have our own vetting checklist that we run through when we are hired to do this type of work for covered entities. So it is very thorough. And for often some of our covered entities, when they are reviewing and vetting business associates or vendors that are offshore, they'll often take extra measures to vet these folks to see if, to make sure that they're secure and comfortable with what is happening in this environment that their vendor is doing business on their behalf. Okay, now that we have an accounts payable list of all of your vendors and you're going through them and identifying who is touching your PHI, we feel that it's really important that you know who these folks are. And this is just an abbreviated list of examples of arrangements that would require a business associates agreement. As you can see on here, we often see covered entities that might forget to get a business associate agreement with their interpretation services or their transcription services or their third-party paper shredding. They often thinking, oh, these folks are just moving this information, but actually they're touching it and physically working with it. So we feel that business associates agreements need to be put in place. At this point of the presentation, we'd like to introduce to you a principle provided by the 2013 Omnibus Rule of a conduit. not being a BAA. So a conduit, like the United States Postal Service or your ISP, internet service provider, is considered simply a conduit. They transport or transmit information and don't necessarily always store it. These conduits are an exception and not considered a business associate. So we like to point that out and introduce that concept to you at this point so that you can clearly identify who is a business associate and who is a conduit that would not need a business associates agreement. All right. Now that we know all of our vendors and who our business associates are, what are our next steps, Michaela?
There we go, unmute. So at this point, I think probably everybody has a sense of how important it is to create a centralized process for this. So, honestly, one of the first things to do is to identify a clear and centralized management process to kind of be an umbrella to contain all the pieces that you have to have in place to manage and vet your vendors and VAs. So key questions that you might want to start out with. Is there an established workflow for signing contracts? So who signs them? Who else might there be that's in the process in terms of managing those contracts, which we talked a little bit about earlier? Is there a checklist in place for vendors, in terms of something to give them that they have to fill out or that you engage with them in as part of that process? And are there sanity checks that are baked into your existing sort of process and workflow? And then, of course, one of the main things that we always like to see is accurate documentation. So that's sort of on all levels. So it's documenting all the different steps that you're taking, the communications back and forth, so that you can show, okay, these are all the things I've done. These were the communications back and forth with the vendor. But another piece of this is also to have a written policy and procedure in place that describes the business associate vendor management process.
Thanks,
I'll let Helen talk a little more about that.
Yes. So we read policies and procedures. We really do. And we like to make sure that your business associates and policy and procedure is written in granularity and specificity that we understand it. And we like to see in that policy and procedure these elements here, that there's a vetting process. If there's a checklist, it's included. So we don't have to search for it anywhere. It's all self-contained in the policy and procedure. How frequently there's an audit or review of your business associates and who is actually in charge of doing that. Where the maintaining the documentation, we want that described within the policy and procedure, what documentation is maintained and who holds it and what it needs to be. Inventorying of these contracts. Oftentimes there's a repository that is separate from the policy and procedure, and usually that's held by the CEO or executive admin, but we like to see that there is a central repository for all contracts, not just your BAs, all your vendors. We also like to see in the policy and procedure written termination procedures. So when a business associate or vendor contract ends, what happens? Do they just stay on your vendor list? What happens? Is there any documentation? How are they securing and remaining keeping the concurrent safeguards to your information? How are they assuring you that they are going to either return or destroy your PHI, or if they can't prove that they can destroy it, what are the safeguards that they have in place to continually keep your information secure, even long after your contract has ended? And a central repository to hold all of your policies and procedures. We like to see that there is one area that all of your workforce members, your managers, your CEO and your board, they know exactly where to go to find your policies and procedures and look up this particular one if they need to refer to it. So we feel that the most important part is to train everybody, your staff, your management, your leadership. Vendor acquisitions are usually conducted by different managers. And we find that sometimes managers come and go, and those contracts are lost. So it's really important that you have a very good onboarding training for your new hires and new managers as to what the procedures are for your business associate contracts management. Managers, they change positions. And so we feel that the training really is one of the most important things that needs to occur, and reminders continually as to what your business associates management procedures look like. And as Michaela shared with us earlier on in this presentation, these breaches cause fiscal and reputational harm. And we see oftentimes that risk oversight is often pushed off to the CEO and the workforce members. But in reality, fiscal oversight is the board's responsibility, and risk responsibility is the CEO, the workforce members, the managers, everybody. And we feel that everybody needs to be a part of this, and tone begins from the top. We like to also look at your compliance committee notes and risk and quality management committee notes to make sure that all aspects of risk are assigned and somebody is accountable. So we've shared a lot with you. We're really excited to also share with you that we are working closely with Cyber Trust Alliance in building a vendor and business associates management tool in the upcoming months to help our covered entity. So please stay tuned, and we look forward to hearing from all of you again soon. We're at the end of our presentation, and we'd like to give this opportunity for everyone on this call to provide us with any questions that we can help with.
Yeah, you can feel free to either unmute yourself, or if you would rather just write your question in the chat. You've got both of those options. Thank you so much, Han and Michaela.
Thank you. Okay, we have a question here. Thank you. Who is usually responsible for terminating BAs and vendors? So we see that often the covered entity will have either the compliance official be in charge of terminating vendors, the HIPAA security official, or IT as the responsible party for making sure that the information is continually safeguarded, returned, or destroyed. Thanks for that question. Okay, see another chat question here. What does the BA and vendor management audit documentation look like? Well, that's a great question, because at PrivaPlan, we have a whole slew of questions and a checklist that goes really, really in depth. And we like to conduct that on an annual basis. And those types of questions look like, has your scope of work with us changed? Does your, as a vendor and business associate, have you started hiring extra subcontractors to work for you that we might not have known about since the last time we signed this agreement? Are they based and domiciled in the United States? Are they accessing this information, outside of the United States? So please reach out to us. Let us know, who you're vetting, and we can help you do that process. And whether or not if you're not vetting, if you're just doing your annual audit, reach out and ask us, because we're happy to help and provide guidance in what kind of auditing needs to take place. And Michaela and I have talked about this too, is that, when we're auditing, do we feel comfortable with what they're doing and what they're telling us? Because that's very important as well.
Yeah, I always think it's a good rule of thumb to think about how much energy and effort you are putting into your data's and your organization's security. And if you're passing your keys over to someone else, you want to know that they have that same level of awareness and investment, basically, in protecting your information when they're using it. So if you, and saying keys made me think of a car, if you're a safe driver and you know all the rules and you're taking really good care of your car, if you're going to lend it to someone else, you want to know that they're a good driver too. So.
Yeah. And also, ask them if they have cybersecurity insurance too, right, Michaela?
Yeah, yeah, exactly. That's a great thing.
If they crash your car.
You want to make sure they're covered.
They're covered, and
Yep.
What their coverage limits are for a breach to help protect you as a covered entity.